Welcome back to Forever Fused. I'm Julie Wilkins, and I'm excited to talk to Karen McCann today. Karen is in Seattle, and she's a virtual friend of mine through the Forever Fused community, and she has a really interesting story that I'm excited to learn more about and to share with the broader community. Karen, like most of us, was diagnosed with scoliosis as a child and had her first surgery in 1984 with the Harrington rods. Consequently, through the years, she began to develop some problems with the Harrington Rod surgery and the instrumentation, and decided just two and a half years ago, I guess, to have revision surgery done. And it was very successful. And thought she had a really interesting journey from the initial diagnosis to the second surgery. So, Karen, I appreciate you coming on and talking to us and giving us some more information about your journey. So why don't you just start with kind of the initial story of being diagnosed with scoliosis and when that was for you?
Sure. Thank you, Julie. When I was about 10 years old, we were at my grandparents'. I distinctly remember it. We were there for a holiday, and my mom got this very strange look on her face, and she told me to bend over and touch my knees. And I just, whatever, sure. And she felt my back. And she'd been working in school. She was an elementary school clerk. So she was familiar with, this was the early 80s. So, she was familiar with kind of early screening that they were doing and things like that. And she said, I don't like this. We're going to go see a doctor. So we went to see the general practitioner. And of course, they're always super helpful. They want to unload you on the nearest orthopedist as quickly as they can. And they sent me to Children's Hospital of Buffalo. That's where I was living at the time and where I was raised. And I saw Dr. Craig Blum there. And he examined me, and he took some x-rays. And he found that my curves were already at, I think the top curve was in the 50s and the bottom curve was in the 40s. And so he immediately wanted to get me into a brace. And so within weeks, I was in a Boston brace, so one that came up to my chest. I was in that for 3 months. I went for my checkup, and he came back into the room sort of ashen. He said, this isn't going to work. She hit a spurt. Her curves are 20% worse than they were previously.
Wow.
So yeah, so from that point, it was a flurry. My parents had to go home and think about what they wanted to do. He was kind of the top guy in Buffalo. We weren't really in a financial position to go looking for second opinions in bigger cities or anything like that. And so I had the surgery with Dr. Blum in Buffalo in '84. And I had a single Harrington rod. I believe was fused from T3 to L4, 3 or 4. And so that went very well. I was in the hospital for about a week, maybe 10 days to include some pre-op diagnostic stuff. And then came home with that. And it was Easter vacation, so I was able to recover without too much time away from school. I may have had a few days, but I went back and kind of got back into the swing of things. I was in a horrible cast for about 6 months that came up to my chest. But I didn't have, I was miserable because I was an 11-year-old kid in a cast, but I had no complications. Everything seemed to be going well. I bounced back pretty quickly. And then I had a pretty good run of it. I had some aches and pains, but it was nothing major until I was living in Chicago. Well after I graduated from college. I think I had already started graduate school there. So I was about 23, and I was getting a lot of what we all know as flares, and extended disco versions of those horrible pains you hope go away very quickly. And I was starting to look for answers there. I was sent to several orthopedists who really weren't terribly knowledgeable about the idea of scoliosis or, the surgery or anything that could possibly go wrong. They were like, no, you're fine. They always tell you your rods and fusion are solid and send you on your way. Nothing could possibly be wrong if your rods and fusion are solid. And so I ignored it again. I was busy. I went through grad school. When I was about 28, I moved to Austin, Texas. And my life started there. And things started to kind of degrade a little bit more in earnest.
Okay, let's stop for a minute and just go back, just a little education for people about Harrington rods. So, and I'm not the expert on Harrington rods. I had my surgery in 1988, and by that point, they were using the latest instrumentation, which was the Cottrell Dubussé, or the CD rods. So the Harrington rods were like the earlier, and I don't know how many years or decades they were using Harrington rods, but sometime in the late 80s, they stopped using those. And the Harrington rod was generally one rod. It was it was straight. There was no curve to it. And the fusion typically went down to that L4 level, leaving people with 1 to 2 movable vertebrae below it, which that's, as we know now, kind of one of the tricks with this fusion. The farther down they go, the less they leave you, the more stress it is on those unfused areas. Is there anything else you could add to that about Harrington rods or that early Oh, and then of course they would brace the kids after the surgery, which was not done. By the time I had my surgery, they were no longer bracing afterwards. Thank God. Or casting. Was it a cast? It was a cast that you couldn't take off. So that's different from a brace that you could remove. They casted you while, I guess, in order to hold everything for the fusion to take.
Yeah, and so I think the only thing I would add there is that some folks would get 2 Harrington rods. I don't know what, I think over time that was some sort of nod to the fact that one wasn't such a great idea. But it didn't make things better necessarily. And it's funny you mentioned the CD rods and the modern instrumentation, because they were already onto the fact that in the early 80s that Harrington rods weren't a terrific idea. When I had my surgery, there were 2 other girls getting surgery the same day, and we were talking beforehand, and one girl was having CD rods. And another girl was having, I don't know if you remember the Dwyer method. It was horrifically it may have even been unscientific. It was such an incredible failure. However, what that means is by the time even in the early 80s, people were starting to rethink the Harrington. And that always kind of threw me.
Well, and maybe not all of the orthopedic surgeons had been trained in the updated or the latest instrumentation.
Yeah, that could have absolutely been it.
Your doctor just still knew Harrington rod surgery.
He did, and I joke now that he was kind of a one-trick pony. He knew how to do this thing. And it turned out later, I would find he did a really good job. My fusion was solid until the bitter end, but it was a terrible, thing to do to bodies back in the day. It was a bad thing.
And generally, and this is going to lead us to what ultimately the diagnosis that you got, but what they started to discover, if I have this correct, is that a normal spine, we have a scoliotic, a side-to-side curve with rotation, but a normal spine has convex and concave curves.
Yep.
Particularly that lumbar spine, you've got to have a little concave, a little sway, a little in and out curve to maintain the upright posture and the balance and to keep the vertebrae level. So what was happening is the Harrington rods they did not put the natural curve back in the spine. And whereas the later instrumentation started, they were like, whoa, we got to leave these people with a little bit of a concave lumbar curve, or else what happens, they start to pitch forward with their posture over time. And maybe that, so when you were 28 and you're starting to have pain, I assume this is low back pain?
Yes,
okay.
Yes. Yeah.
And was it like nerve pain? Was it ache pain? Was it pain that kind of came and went? And then did it just start to set in and not go away? Is that sort of how?
I am incredibly fortunate in that my nerve issues were weakness. They weren't pain. My pain was generally muscle and joint. And so, yeah, exactly. It just started to settle in and didn't go away. And I noticed I was starting to get that characteristic pitch forward. and my knees were starting to, you kind of get the loose knees to kind of compensate for the fact that you're pitching forward. And my neck was starting to sway. You get what they call swan neck, and it's all compensatory.
Right.
Your whole body is working, all the time to try to get you to stand up straight, and you can't. Structurally, you're not there anymore.
And this is just beginning to happen like 15 years later. Is that about right on my time frame?
Yeah, I'm always shocked when I read about women who have had surgery in like the 70s and still are pretty active today with fairly limited pain. They're few and far between, but I got about a dozen good years before things started to really go downhill.
And now this isn't, well, actually, before we go into that, there's actually a name to this that occurs, and it's called the flat back syndrome or flat back. Are there other names for it? You can describe more about that.
It's, doctors, the sort of medical terms behind it differ, but it's sort of colloquially accepted in the medical community as flat back syndrome. And what it means, they call it a syndrome because it's not a disease unto itself. It's a constellation of conditions and symptoms that, when put together, are pretty characteristic of folks who've had Harrington rods for a number of years, and their spines are beginning to react to the required compensation. And so what flat back may include, and generally does, is spinal stenosis, which is a narrowing of the spinal canal, which can cause a lot of neuropathy, weakness, and numbness, degenerative disc disease, arthritis, slipped disc, the worsening of the scoliosis itself. I joke that when you do the spine conditions on WebMD, it's kind of a checklist for me.
Yeah.
And so that's kind of what flat back is. So it's always, I always feel compelled to say, when people say, I have all these things and flat back, what do I do? Like, no, you have flat back because you have all these things.
Right.
It's just kind of shorthand that they were able to get to with regard to the fact that these folks were continually coming in presenting almost the same symptoms.
But not everyone that has had Harrington rod surgery is going to necessarily develop this. Do you know any kind of percentage or numbers on that?
No. The statistical stuff is tough. It is a growing number. It tends to be women who, I'm on the young side of the spectrum. It tends to be women who are in their 50s or 60s. I was 42 when I had 43 when I had the surgery. But the numbers growing. So it's tough. Statistics are not gathered. There aren't great, nobody's researching this.
Well, and Karen, do we know about people like myself with the later instrumentation that came around? Do we see flat back? And I'm asking you difficult questions. So, if you don't know, that's perfectly fine. We are not medical doctors, by the way.
Yes.
We're just telling our own stories. So do you know, is this something that can develop in people, or is this just specific to Harrington's?
I think the answer is it's less likely. They were much more cautious about ensuring that they did maintain those curves and that they focused on a 360-degree correction versus, because when you have scoliosis, your spine doesn't just curve, but
it rotates.
That's the part that people forget. And so the modern surgeries really get that and work to fix that. So I think that that's a part of it. And then the few cases that I've heard of where somebody had flat back syndrome, it was because of poor surgical technique, unfortunately, maybe with a doctor who wasn't as adept as he or she should have been.
So how did you, when you were in you went through probably all of your 30s, mm-hmm. because you kind of really at 28, it really was getting bad, and you didn't have your revision surgery, which we'll get to at 42. So you've got all these years of like high productive years of your life.
Yeah.
And you were basically decompensating, your posture was changing, and you were in great pain. What were you trying to do to manage this in that 10-year, 12-year time? 14-year time period even?
Well, by the time I got to Austin, I was living there for maybe 2 years when I discovered Dr. Geck's clinic, and we'll talk about more about him shortly. But he was my doctor previously, probably for about 10 years prior. His clinic worked on me on things like PT and epidural injections, and there were a lot of things that I did, some alternative, but I'm sort of cynical, so so I kind of poo-poo a lot of that, and it didn't work anyway. I mean, you reach a point where it's just not working. There was some pain management, but as things started to really decompensate, there was no pain manager in their right mind who would have given me the amount of drugs I would have needed to be in comfort. So,
Wow.
I was taking like tramadol, but it's very, very nominal from that perspective. Trying to exercise, but understanding that your spine becomes very unstable and your vertebrae start to actually shift back and forth. And so you just reach a point where even that's not optional. I had gone through a phase where I was going to the gym pretty frequently and I was feeling okay, but it's very finite, and then there's kind of a new bump in the road and you try to figure out ways around that. And it's just this continual, how can I make things not be so painful? What can I avoid? That's another problem. As you start to really decompensate, you start to avoid crowds. You start to avoid situations where you have to stand or walk, because those are the hardest things. You grab a cart when you go to the grocery store. You, even if you need 5 things, you don't go out with friends because the bar might be crowded and you might not get a bar stool, kind of thing. And, I was a young single woman and it was increasingly difficult. I met my husband, and, he's wonderful. And just over time, I started to accept the idea. It's an intensely emotional, hard decision to make because we've all already been through so much. And it was probably a couple years of me psyching both of us out before I even got to a point where it was a true consideration, even though I was in terrible pain.
Well, and Karen too, your physical posture had changed so much. I mean,
Yeah.
you were beginning, and I want to really make a little bit of a clarification if people have not seen the posture of flat back syndrome. It's not a rounding forward like you would see in an osteoporotic or a kyphotic spine where the upper back rounds forward. It's literally like a pitch forward from the hips, where you can't right your head upright. Your back is just completely straight, but it's pitched forward. You have no lumbar curve. So your bottom's like tucked up under you basically, and you're pitched forward. And then to stay upright, you probably have to bend your knees. Is that correct?
Yeah.
So you can't stand upright.
No.
So you had to probably be sitting or lying down.
Yes. Yeah, that was the only time I was comfortable, if I was sitting and lying down. Unfortunately, I didn't have nerve problems that created a situation where even those were uncomfortable, and some people do.
Yeah.
But your posture, and you're just exhausted because your entire day is spent trying to stand straight. Your body and your brain aren't, they're not receiving the right messages from one another, and it's just exhausting.
Yeah.
And that's what sends a lot of people to, really consider the revision. The pain is terrible, but you sort of get to a point where you're like, okay, this is my life. But when the exhaustion just takes everything out of you, that's really the tipping point for a lot of folks.
And I could just imagine the emotional drain and the depression and just the frustration, particularly when, look, you have the scoliosis that you go through the surgery expecting to be corrected and ultimately end up with a painful outcome down the road. I can imagine that was very trying for you and the other people who deal with this.
Yeah, and one of the things folks talk about when they first come to the forums and really embrace the fact that they have this and may need surgery is that it's so distressing when you see one of your current x-rays, because your curves get worse. As you begin to decompensate, it doesn't matter that you have this rod in your back. It doesn't matter that there's this stainless steel post in your body. Your spine's still curving. And it's so mind-blowing and crushing to folks, myself included. When I saw it, I was like, really, what?
So you mean even, Karen, even with your fusion, the spine was curving into his...
My pre-revision spine was about 15 degrees more curved than I had been, after surgery, whenever I had x-rays.
Wow. Okay. So you decide, okay, I've got to do something. I'm going to have this whole thing completely revised. No small surgery. Bigger than the first surgery, would you say?
Yeah, because there's so much more pathology involved.
Yes. So
it's a much thicker spine.
Yes. And an older spine. And oh, wow. So so first off, there are very few doctors who will do this.
Yes. Probably it's not hyperbolic to say there's probably about 30 nationwide that can be trusted with it.
Okay. And you found one of those.
Yes, I lucked out. That clinic that I went to when I was starting to just first look for answers in Austin, I met Dr. Geck, Dr. Matthew Geck, and he was the first one. He diagnosed me actually about 10 years before I had my surgery. And I loved him. I loved his bedside manner. I loved his curiosity. He was just wonderful, but I was like, ooh, he's young. He hasn't done enough of these. I can't, if I were to have this, I'd go to, somebody else. And over time, I sort of ignored, I was initially very anxious on all the forums and asking a lot of questions when I was first diagnosed. And then I was like, well, I can't do this right now. And all this is doing is ratcheting up my anxiety. So I kind of ignored it for a couple of years. And then when I went back to look at it more in earnest, he was kind of the guy coming up on everyone's short list. And I thought, well, this is interesting. And so when, about April of 2015, so I had the surgery in 2015. We had moved to Seattle in 2014. And about April of 2015, I thought it was a flare, but it was the absolute end of the road. I was in horrific pain. I could not walk. When I did, I felt as though I had several broken vertebrae. Taking a shower, even walking down the little hallway in our tiny Rambler, everything was just horrifically, excruciatingly painful. And I began researching doctors here because I was like, well, this is Seattle. There's got to be folks. And there were some folks who talked a big game, but after so many years of research, I was reading between the lines and I was just like, I am just not comfortable. My husband didn't love the idea of traveling. He was overwhelmed by the idea. Having been in these forums for so long, I knew that a great many people had to travel to find the best doctors for this. So it was less of a shock to me. And in the interim, we checked our insurance and he was covered. Wow. Despite the fact that we were in different states. Some of the top doctors, and I would imagine this would be true in a lot of specialties, make kind of blanket agreements with like Blue Cross and Aetna and things like that, kind of nationwide as opposed to individual plans. So that's something for folks to keep in mind. Don't panic yet. And I went to go see him. I had an appointment for a lot of pre-op stuff, and for him to check me and do some x-rays and things like that. And then I think that was in the summer, and then we got on the calendar and he, these are all-day surgeries, so it takes months to get on his calendar. So it was October that it happened. And the pre-op stuff is, it's things like a myelogram so that they can really see what's going on with the spine. MRIs and CAT scans, they create a lot of what they call, what we all know to be what they call artifact, which is basically a flash where there's metal. And so they can't get an idea as to what's going on with the spine to any sort of, detail. And myelograms enable them to, with contrast dye, they're able to take a little bit more of a moving X-ray kind of thing. And they're much more detailed, and they give the doctor a lot more information about kind of where things are and what he or she will find when she gets in, when they get in there.
So you schedule the surgery, you go in. Do they remove the Harrington Rod?
No.
No, because they can't probably. It's probably so scar tissued in there.
Well, I asked him about that, and he was just like, oh God, it's so much harder than just leaving it in. And my fusion, this is the weird part, you're falling to seed, but your fusion may be absolutely rock solid. And mine was. And so he said, we do not want to go in there and take all that out. Some folks have to do that. It depends on, maybe some of their hardware is broken, or, something is wrong with it. So their fusion's not solid, that kind of thing, then they'll go in and remove everything. And
it's probably a lot of physical labor to remove that. I've heard very difficult surgery there.
Oh my gosh, yeah. And I was teasing my surgeon. He's so much more fit now than when I met him, just because of all this physical labor he goes through in surgery.
Yes.
And so they cut it in half. They remove the lower part of it. They do something called a wedge osteotomy. They take one of the vertebrae and cut a wedge out of it so that they can reform the disc to kind of artificially recreate that curve again. That's a big way they go about it.
Okay.
And then they go and reinforce everything with, I'll share an X-ray, but it's 2 rods on either side to fully reinforce it, and then all of the screws that hold everything in, and then everything attaches to the old rod. And then in my hips as well, there are big screws to also anchor everything.
They have to fuse all the way down and into the sacrum.
Yes.
Okay. So
my fusion was extended from L3 to S1.
Which is really crucial just to get that all restabilized. They've got to get it in a nice, good, healthy position for your postural alignment, but so there's no more mobility there. So you're fused from wherever the top was, T2 or 3, probably, all the way down and through. So your thoracic spine curvature, whatever you were fused with the Harrington, that's still probably the same. Nothing was changed.
Yeah, I'm pretty flat on top. Yeah.
Were they able to get some new correction of the lateral curve of your lumbar spine too? Well, you said your scoliosis was starting to curve and rotate down there. I was wondering if did you feel like your hips were realigned?
Yeah, actually. And a rib hump I had was made almost unnoticeable.
So they cleaned it all up.
Yeah, it's kind of cool from that regard. And then a few weeks after that, you're not done. So it's about 9 hours. It was for me. I shouldn't say it is anything, because everybody is so very different with the surgery. It was about 9.5 hours the first time, and they went through the back. That was the posterior half of it. 3 weeks later, a vascular surgeon opened me from the front, and my doctor was actually the assistant in that surgery, and the vascular surgeon was creating a path for my doctor to go in to fix my spine, to add 2 cages, what they call cages, onto my vertebrae, especially where that osteotomy was, because it's just so unstable and fragile, to create full 360 stabilization.
Wow. Is this a pretty standard revision surgery, or are they all different?
They can all be different, and it depends on the surgeon. It depends on the health of the patient, whether or not it's 2 stages. Generally, they do go in through the front and back, but there is no hard and fast rules. I've talked to some folks who only had the posterior, and he wasn't sure he would need to go in through the front and back. But my stenosis, that narrowing of the spinal canal, was particularly severe. and cleanup for that took a little bit longer, and he wasn't able to, do some of the things that he needed to only do it in one state.
Were you just living in, because you had a 3-week period of time, I'm sure you weren't recovered in the 3-week from the first surgery. Did you just live in Austin for that time period? Yeah.
Yeah, we rented a condo for a month in Austin, and luckily my husband's job, and it allowed him to work remotely.
That's amazing.
To say we were fortunate would be a gross understatement.
Yeah. So what was the recovery like? How did you get home? How were you able to finally tolerate getting home? And what was that recovery like?
So we got to Austin, I think in the second week of October, and we left on like December 1st or something like that. And the back surgery took way longer, but the anterior surgery was so much less pleasant and so much more painful just from a movement perspective. And so you've got nowhere to go to kind of get away from yourself and your pain. You've got it in the front, you've got it in the back, and it's rough. But, I was cleared to go home. We needed to, and we booked first class flights because we were like, I said, I need as much comfort as we possibly can. So it was terrible. It was a terrible, terrible flight. I cried through half of it, but you live. And so, and I got home and I started back to work, I think January 18th. So it was pretty quick. And if I had it to do over, I don't think I would have. I was on short-term disability. And so, there was that month, but almost a month between the two surgeries, and that all counts. And then you've got some recovery time and things like that. But it was a little soon. Fortunately, again, just good fortune across the board. I was working for a company that allowed me to work remotely, leave when I needed to, made a lot of concessions with regard to a standing desk and anything I needed with regard to a chair. It's not a physical job. So I went back January 18th, and probably by about mid-February, I was full-time. And the funny thing is, I actually got promoted. My boss joked that if I could do everything I was doing from bed, that, they had a pretty good idea I could succeed while standing.
I hope you showed them x-rays, because no one really understands the extent of that until they see your x-ray, and then they're like, whoa.
Yeah.
That is amazing. What was the new posture like? I mean, because your body was completely realigned. You got a little lumbar curve back in. You probably gained some height again. What was that like, finding a new body?
It's disorienting at first, but like everything else, you get used to it very quickly. It's much more disorienting to people who see me after my surgery. It threw my husband. I stood in the ICU while I was still in the ICU, and he was like, whoa.
A new shape.
Yeah. And so to me, my inner vain self was pretty excited with some of the changes. My hips were even, my rib hump was gone. I was standing straight. I didn't, things like that. But maybe it's like, I haven't had children, but people talk about the pain of childbirth and how you forget it. And I think that a lot of this is that, like, I can sort of intellectualize remembering that pain, but I can't go back to it in any way, shape, or form, or even that posture, because it was so overwhelming and painful. I can't really remember it that well.
Yeah.
That feeling of being stuck.
Yes. I can imagine that was very, very challenging. What about the loss, though, of mobility? Did you feel, I mean, maybe you had already lost so much in that time period, so you didn't notice, but you now fused lower than you were. So you did lose mobility during this revision surgery.
Yeah. One of the things the revision surgeons will tell you is this isn't emergent to come back when your life is, just not livable anymore, because it is imperfect. There's no perfect magic bullet for this. But most of us are to a point where we may not be walking. We may be so pitched forward we can't even look up. and everything feels like an improvement. So I can still get down on the floor and get up off the floor. I have trouble picking things up off the floor. That's challenging. But, you know, I can sit on the couch and get comfy. That took a long time, but I'm there. There aren't too many things that I really, really miss that I had before that I don't have now.
That's good.
Yeah. And
That's
not
good.
being in pain just makes everything else kind of a moot point.
So you have no pain now?
I have aches. I have stiffness and I have aches. But, you know, I didn't live in a world before where I could pop in a leave and get on with my day.
Right.
And now I can.
Right. It's a big difference. Are you an exerciser? Have you gotten back in to do anything now with the new body you have, the new revision?
No. It's bad. It's really bad. And it's one of my resolutions. The doctor wanted me walking 3 miles a day by 3 months. And I was a champ. Even in the Northwest rain, I was out there every day and I was doing it. And then I went back to work. And now I have an even busier and more stressful job. And you're tired. The fatigue never totally goes away because your body's still not doing what it should be. You know,
right.
Yes, you're more balanced, but your brain knows something's up. So you're still really, really tired. And I come home from work and I go to sleep very early. And no, I have been a bad exerciser.
Well, that's okay, because you make a good point. With a full-time job, you know, there is only so much room in your schedule for that, and just your energy, the demands of that from your energy. I don't know, you know, do you have a 40-hour-a-week type of position?
Yeah, actually plus. Yeah.
Yeah. Or do you have a desk job? So do you sit mostly? And are you having any problems with that, or is that good for you? The long days of sitting.
No, well, I try very hard not to sit for long, and I do have a standing desk and stuff like that. So, you know, I'm not tethered to my desk by any means, and nobody thinks twice if I get up. But I do need to join a gym and get a little more involved in exercise routines and things, something that'll force me to do that.
Well, back to the standing desk, because I'm sure people might be interested. Is this something you ordered, or is this something you just fabricated in your office?
There is a great one that you can order online called Veridesk. And I had that at my last job, and it just sits on your existing desk and goes up and down. And then the one I have now is motorized, and you push buttons and it goes up and down, and work gives those out by request.
Oh, wow. That's great. That's very helpful. Well, wow, Karen, this is quite a story, but ultimately you had a very successful outcome.
I did.
And since you are in the flat back forums, which I'm not in those, so I don't see more of the masses, is this pretty typical? Are you seeing good outcomes in general, or is it across the board? Does it
increasingly vary? Yes, because those of us who've had this surgery are pretty rabid about really preaching going to the top people. This is a great way to lose whatever quality of life you have if you go to the wrong person. And there are some folks who, unfortunately, you know, at a different time and a place, went to their local orthopedist and let them do this to them. And their lives are not good, unfortunately. But even some of the older folks, I'm kind of blown away. There was one woman, the woman who started the group, who actually went to Dr. Geck. She'd had 3 failed surgeries, and like horrifically botched. And he's got her on the straight and narrow again, and she couldn't be happier.
So this is Dr. Geck in Austin, Texas, who's obviously one of the top. Do you know any other names off the top of your head, or where should people go to find the specialists for this?
Yeah, so on the East Coast, it's kind of an embarrassment of riches. There because of the Hospital for Special Surgery, and I think NYU and Columbia both have really robust orthopedic clinics as well. Dr. Lenke, Lenke, is fantastic. Oh gosh, I'm drawing a blank. He's kind of one of the top guys. He trained Dr. Geck. I'm embarrassed that I'm drawing a blank.
I'm thinking of at the Baylor Scoliosis Institute in Texas.
Oh yeah. So I was just thinking, there are probably 10 of them in New York City. I don't know why I'm drawing a blank on him, but yeah, at Baylor.
It's Dr. Hostin and
Dr.
O'Brien.
Hostin. Yeah. So O'Brien, I think he left. He might be on like sabbatical or medical leave or something.
You're right.
Dr. Hostin is, he's the top guy there now, and he's supposed to be pretty fantastic.
Yes, and we have some people in our Forever Fused forum that have had some revision done with Hostin and had good outcomes too. So,
and then on the West Coast, there's Dr. Who. She's one of the few women in the group.
Wow.
And she's at Stanford. And there are a few folks at UCSF. Dr. Bervin, it's either Bervin or Brevin, I always get it wrong. And he's fantastic too. But you know, there's a smattering of doctors, and what's strange is that they aren't always in big cities.
Yeah.
Interesting.
And they're doing standard scoliosis surgeries too.
Yes, yeah, they are. Because, well, it's funny because the science of that surgery has come so far that, you know, much of what's being done with that primary surgery, to some degree, still needs to be done in revisions. You need to know where to put the pedicle screws. You need to know where the new rods need to be placed and all of those things. So yeah, they're still doing those as well.
I would almost, my perspective would be, I would almost want one of those surgeons who have seen the outcomes and they're doing revisions to actually do my initial surgery. If I had the luxury of travel, or, you know, and a lot of times you're a child going through this and it's all up to your parents.
Yeah. It's very, very daunting, and a lot of people do travel, and the reality is that the woman that I mentioned who started the revision group, she had no money. She had no money, and her family was unsupportive. And she said, I'm not going to botch another surgery again. And I need this surgery, and I'll go by myself to Dr. Geck. And, you know, with some wherewithal, a GoFundMe, and some online support from some folks, she made it happen. And so I think that instinct to shut down when somebody tells you you might have this thing that may require more surgery, everybody has it, but I think it's important to just sort of, you know, keep an open mind about the idea and understand that you deserve more than pain for years and years and years on end.
Yeah, Karen, and I've seen some people in our group, our group that's not for revision, our Forever Fused group, who are suffering right now and who've had early Harrington surgeries. They're fused to L4 or even L5. They're in a great deal of pain. And you've chimed in at times, and I think you're a good support to say, you might get to this point. It's not going to be easy, but there's some instability and structural issues, and no acupuncture and no yoga therapy and no PT is going to fix it. And people have to come to their own decision in their own time on that. But what you would say is, it's not easy. It's crazy hard, but I'm so glad now I'm 44, I guess, or something. You know, you've got the rest of your life now. You're in a much better situation.
Yeah.
You know.
And, you know, there's no shortage of folks in that revision forum who are very, very grateful they did it. And newcomers are always shocked when the folks who are on the other side say, I wish I'd done it sooner. They're always shocked.
Yeah.
I wish I'd done it sooner.
Yeah, that's amazing. Like I said, you just have to get to the point where you cannot live anymore the way you're living.
Right.
And you're gonna go to the lengths that you have to go to have that done. I so thank you for talking today. That was great information. I really appreciate your time, and I'm so happy for you. I really am.
Thank you. I really appreciated this. It was fun, Julie.
Thank you so much, and I'll see you on the interwebs very soon.
Okay.
All right. Bye, Karen.